Hey you guys, just wanted to come in and tell you all about my cystoscopy appointment. I just left the hospital from having the procedure done, and surprisingly, it wasn't as invasive as I thought. If you have been with me on this UTI journey, it has been a long one. My name is Anika. Welcome to my channel, Well with Anika, and I am just talking about things in my 50s, being a family, children, business, health, wellness, all the things. If you're interested in my UTI journey, stick around. I went for my cystoscopy today. If we go back, I have had 4 different antibiotics I have been on over the last June, July, August, September. This is now October, November. This is November. So over the past 6 months, I've been on 4 antibiotics. I had surgery in May, hysterectomy. Ever since then, like maybe 4 weeks after my surgery, I started to notice I was having UTI symptoms. Went to an urgent care, got an antibiotic. It was the wrong one, got sick. Went to my doctor. She put me on one for 7 days, then another one a month later because it was still showing that I had bacteria there, for another 7 days, a different one. Then I went back to the very first one, which was Cipro, after I saw a urologist, nurse practitioner. She ran a home test called Guidance. I have a video on that. Sent that test off for a more extensive urinary symptom or urinary urinalysis, and it came back that I did have some other bacteria there. She gave me another antibiotic that I had been on, which was ciprofloxacin, I think it's what it's called, and was on that for 10 days, and the symptoms got much better. I stopped having the symptoms of having to urinate frequently. I didn't realize how much I was getting out of bed in the middle of the night to use the restroom until I got off of that antibiotic and realized how well I was sleeping. I was so shocked. Like, man, I was getting up 4 or 5 times a night going to the bathroom because the urgency to pee was so strong, it would wake me up out of my sleep. And during that time, I did have to urinate. It wasn't like just a little bit, but I just couldn't hold it. It's been nice not having to run to the bathroom every 5 minutes, being able to run from point A to point B without having my first stop be the restroom when I show up somewhere. Because sometimes it's embarrassing as soon as you hit the door and you're like, where's your restroom? After that telehealth and that antibiotic, I was scheduled for a cystoscopy with the doctor. His name is Dr. Hadley. Very nice doctor. I feel like he's very thorough. I'm here at that appointment today, and I have to tell you, I was a little nervous about what was going to happen with the procedure because they do it right in the office, and knowing that someone is going to stick a camera up your urethra is intimidating. Of course, I took to YouTube like I always do to look at different procedures and how they're done. And I found one particular doctor that I love. I follow her on Instagram. I'll have to give you her name. She did an actual video showing us what the scope looked like and how the procedure would go. I had a little bit of understanding prior to showing up this morning about how the procedure was going to go. And there's this long, flexible tube that they stick in the urethra, and on the end of the urethra is a camera, and they can actually see inside the bladder, see all the intricacies of the bladder to see if there are any polyps, nodules, stones, or anything like that. And they can also see if you have interstitial cystitis. He didn't make any comment that I did have any of that, because from my previous video, I was thinking that maybe that was something I did have and have been watching what I was eating and drinking. But after the last antibiotic, I kind of stopped because I was feeling much better and I wasn't being irritated by coffee and tomato sauces and acidic foods. I haven't really been on the interstitial cystitis diet that I have been researching. I'm not saying that that's something that you might want to stick with, but it's something that I haven't really been sticking with. I love my coffee and I love tomatoes and acidic foods. I was called back to the front desk to go ahead and do a urinalysis. They wanted me to go ahead and get a sample of urine prior to the actual procedure because they didn't want me to have a UTI prior to going to have the procedure. The UTI didn't come back with any bacteria. However, there is still showing blood in my urine, right? Which was what was going on with the last test before she sent Guidance guidance test, I was still showing blood in my urine, and then when they did the little bit deeper dive, they found there was bacteria. And so I was kind of nervous this time, seeing that there was blood in my urine prior to doing this procedure, but I guess there wasn't, bacteria didn't show up, just blood. And so he says you can still move forward with the procedure. They called me back to a room, and you get undressed from your waist down, and it's set up kind of like a gynecology visit where you lie back and your knees are up. My legs were not in stirrups. They were just up on the table as if I was laying on my back with my knees up, legs apart, so they can access the vagina area and vulva area. They take a soap to clean, which kind of looks like iodine to me, and they actually clean out the vaginal area first, and then they also clean up where your urethra is and everything. And then they take the scope and stick it in the urethra. That stung. You know how you get soap on a wound and you have that burning feeling, or if you wash with soap too much down there, you get that burning feeling? I did have that feeling when the scope went in. I'll say the scope was probably in no more than 1 or 2 minutes. It was really, really quick. He took a look around. I looked up at the camera. I could see what he was looking at. I could see the inside of my bladder and all the veins and just the pinkness of the bladder. He said everything looked good. He didn't see any stones, no polyps, no tumors or cysts or anything. And he said based off of what he saw, what he felt like next steps would be was to have a CT scan. He wants to make sure that my kidneys are okay. He wants to make sure that the line from my kidney to my bladder is okay, and just to make sure he's not missing anything additional, because there is the presence of blood. He also shared with me that he can have blood in his urine as well, and he's been living with that for a while. Sometimes your body will release blood cells into the bladder, the kidneys, or the urethra, and it will show up in your urinary test. And to not be so alarmed by that, as long as you don't see blood in the toilet and as long as there's not infection there. He also was concerned with, as he was looking, to make sure there were no stitches, staples, that the bladder hadn't been compromised by having the hysterectomy or nicked or anything like that. He didn't see any of that. He also said that the CT scan will just give us a peace of mind, and that we may just have to break the cycle of urinary tract infections. When he first came in, he said, I see you've been having reoccurrent infections. And my thing is, and I told him, I don't know that it's reoccurrent. I just feel like it never went away. Every time I take the antibiotic, I feel better, but then when I get tested again, it's still there. So I don't know if it's reoccurring or if it's the same one. I was just editing my video, and I just realized there was one thing that I forgot to talk about, and that was the speculum. So he did a pap smear, and they stick the speculum in, and it was a plastic speculum, not the metal one that you normally get. And he said he wanted to stick the speculum in and do a vaginal exam because he wanted to see if my bladder had dropped significantly, and if that was something that needed to be addressed as well, since having the hysterectomy. And so when he put the speculum in, he asked me to cough. I did. He asked me to cough one more time. I did. And then he asked me to bear down as if I was pushing out a baby. And so that was to see if my bladder was to drop or give way when I did some of those things. And if maybe my pelvic floor, I didn't ask. I think I was just so overwhelmed by everything that was happening. I just didn't ask, other than him saying that he was checking to make sure the bladder hadn't fallen. I wanted to ask about my pelvic floor. I think that's something I will ask the nurse practitioner when we have our telehealth in a month follow-up after the CT scan, to see if there is some pelvic floor therapy I can possibly do to strengthen that area, or to see if that was even a weak area according to his exam. And I'll look through my after visit summary to see if he put notes in my chart. But I imagine that he would have said something had that caught his eye. I don't know, but just wanted to come in and say that that was another exam he did during the time that I was there for the cystoscopy. Hopefully we will do the CT scan and it will show that nothing is going on. That's what we're praying for. And that's what he prayed for. We actually said a little prayer prior to him leaving the room. And he asked if it was okay that he prayed for me, and I told him absolutely. We had a prayer, and we just asked God to just cover me as I'm going through this journey, and we thanked God for seeing me this far, and that this will be the end of my journey once we get clarification with the CT scan that everything is fine. So the next steps are waiting on central scheduling to call me to schedule me for the CT scan. And then once we do that, I have a 4-week follow-up with the nurse practitioner just to see and make sure everything is going fine. He says if I have any problems after this particular procedure, I start to feel like I have a UTI again, to give them a call and they would help with that. Prescribe another antibiotic. I don't really want another one because I don't want to become resistant. Like I've said in previous videos, I feel like once you have too many antibiotics, and there's a lot of studies that show, and they're always talking about you quit giving out antibiotics when somebody doesn't need it. And I know I need it because of the infections. However, I don't want to have to be on it. I'm going to be more diligent about drinking my water. I'm just going to do the 1 cup of coffee a day, or maybe 3 times a week, and just do more foods that are bladder friendly and urinary tract friendly. I have slacked up on taking the demonase. I'm not taking the oregano oil pills anymore. I've slacked up on a lot of things because I have truly felt better after that last antibiotic, but I am shocked to see that there is still blood in my urine today. I will keep you all posted on what's to come. When I have the CT scan, I'll check in with that to let you all know how that goes or how that went, just to give you a heads up. But if you're scheduled for a cystoscopy and you're worried about if it's going to bring more pain than what you're having already with your urinary symptoms or bladder symptoms, trust me, it's not as bad as you think. I was really in my head about it, but after today and the doctor really putting me at ease and the way everything went, I'm happy it wasn't what my mind was telling me it was going to be. I'm happy it wasn't as bad. No worries there. I know everybody's body is different, and your experience may be different than mine, but if I can put you at ease, it's a very quick procedure. There is some discomfort, but I wouldn't say pain. Right now, sitting in the car, just coming out of the doctor's office, I don't feel that urgency to pee, or I don't feel the burning anymore. So I think I'm good. I'm just gonna drink a ton of water. I have my bottle of water here. When I get home, I'm gonna fill my big 40-ounce cup up. I'm just gonna drink a ton of water and just really make sure I'm able to flush everything out. I am gonna take some of the demonase when I get home to do some more flushing of bacteria, and just really, like I said, stay on my water all day. All right, you guys, I hope this was helpful. Turn on the notification bell if you're really interested in hearing how the CT scan goes and what the end result of this UTI journey has been. But until next time, you guys, be well.